Hi, my name's Dr Sophie Sundays and I'm the founder and medical director at Illuminate Skin Clinic in Kent. Today I'm going to talk to you a little bit about hair loss. It's something that many of us, probably most of us, experience at some stage of our life, men and women, but it's something that's maybe less talked about in women, even though it has a really big psychological impact. We're going to go through a few of the common causes, why this might be happening to you, and how might you be able to determine which one's driving hair loss for you. So I think the first one we're going to cover is hormones. Obviously, as women, we go through regular hormonal fluctuations, and those don't have a particular impact on our hair. But if you go through a sudden hormonal change, such as stopping the contraceptive pill, having been on it for a long time, or developing a hormonal disease, thyroid, polycystic ovaries, these can all have an impact on our overall systemic balance and therefore on our hair. So it can be, if you develop one of these, if you develop a hormonal condition that causes your hair to thin, then really you do need to look at addressing that hormonal imbalance to recover your hair growth. In some cases that might just be as simple as giving your body time to recover its balance after stopping the pill, but if you have a thyroid condition, you will almost certainly need some medical treatment for that. Stress is a huge one, and that can be mental, emotional stress, but it can also be physical stress. So it could be to do with the fact that you have had a major life event like a divorce recently. It could also be that you've been sick, and that illness, the stress of that on your body has meant that your hair follicles have been undernourished and you start to shed hair. It's a really common one that I've seen recently in people who've had COVID, that once they've recovered a few weeks later, usually about 6 weeks later, their hair starts to thin. And it's just because while we're so sick, our body is driving all of our resources, all of our nutrients, all of our energy to healing rather than to growing hair. So that's a very common one. Diet is also another one. And it's something I see a lot when people have been on major crash diets. So they diet, they lose their weight, they feel their hair's looking good while they're doing it, and then they start to eat normally again. And that's when their hair starts to shed. So what's happened there is that the lack of nutrients, the lack of calories have meant that your follicles have gone into a quiet state. So they've gone to sleep, and that means your hair's still there, it's all good. But then when you start to nourish it again and the hair starts to grow, it pushes out the dead follicles and you start to shed. So that can be a big driver. Genetics is really important as well. If one of your immediate family, parents, siblings have hair thinning, then it is more likely you will develop it too. But genetics are actually really interesting, and I am going to come back to them a little bit because they can also help us to understand what treatments might work best for your individual hair loss. Pregnancy is one I see a lot in women. So while you're pregnant, your estrogen levels are high, and estrogen's what gives us that lush hair and bright, shiny, glowy skin. And then you deliver your baby, and again, usually about 6 weeks to 3 months later, your hair can start to fall out. And it's again because of that drop in estrogen levels, that sudden quick drop. Fortunately, in most cases it recovers, but it can be emotionally quite difficult at a time when women are trying to get used to a new normal. They don't necessarily feel like themselves, and then all of a sudden their hair falls out. There are also medical conditions that we've not touched on yet that can cause hair to fall out. So for example, something called trichotillomania or hair pulling. So this is where you will sit and pull hairs out. It's almost on the obsessive compulsive spectrum, and the best treatment for conditions like that are to get psychological help and intervention, and they can work very, very effectively. Diseases like alopecia areata can be autoimmune, and so these can be driven by an overactive immune system that causes patches of hair loss to form, and sometimes complete hair loss. These are often best looked after by a dermatologist, but again, there are things that can help. Product build-up on the scalp is something that many people don't really talk about, but a lot of the time we're using a lot on our hair and we're doing nothing to, it's quite hard to thoroughly cleanse your scalp. So when people talk about why their hair feels so much better after being washed at the hairdressers, this is usually why, because we've managed to clear some of the product buildup and our scalp has been massaged and the circulation stimulated. So if you are conscious that you're using a lot on your hair, sometimes a good solution might be to use an at-home hair scrub to clear some of that buildup around the roots and allow hair to grow better again. A lot of people also don't realise that actually we shed more hair in spring and autumn than we do over summer and winter. So if you're suddenly noticing there's more on your brush at those times of year, then you're probably just suffering from seasonal molts, which is absolutely nothing to worry about and a very normal part of our seasonal routine. So genetics have driven quite a lot of advances in many fields of medicine, and an exciting one that I've come across over the last year has been to do with understanding hair. So there are lots of things that have traditionally been touted as treating hair loss. That might be minoxidil, it might be finasteride. You might go to a clinic and people might recommend some very, very expensive courses of treatment. They work really well for some people and less well for others. And that's why this test has been so helpful for me and my patients, that it's a little mouth swab which takes a sample of your DNA, it's sent off to a laboratory, and it will then tell us what is driving your hair loss and what will work for it. So that would allow me to prescribe bespoke formulations that will address the problems in you, or recommending clinic treatments that are going to give you the best results. And there are lots and lots of options in clinic as well. I'm a big fan of PRP and growth factor mesotherapy. So both work with growth factors, but both are slightly different. So PRP involves taking a sample of blood from your arm, which is spun in a special machine, and we inject a portion of it, people call it liquid gold, back into the scalp. And that releases growth factors and drives hair growth. But obviously that's all been taken from you. So it is also a little bit dependent on how healthy you are, how healthy your platelets are, whether you smoke. Lifestyle has a bigger impact on that. Growth factor mesotherapy uses growth factors that have been developed in laboratories, and we can inject or microneedle those into the scalp. Microneedling on its own is actually shown to have very good results for hair growth, and can be combined with mesotherapy, so using nutrients to nourish and enhance the scalp. LED light is something that has also come to the forefront. So it's something people know very well for the face. There are a lot of commercial masks on the market now, but actually caps containing LED lights have also been shown to have a very positive effect on hair growth. So in clinic, those are the kinds of things we might look at. I will also always look at whether or not you're suffering from any vitamin deficiencies. So there are several linked to hair loss and hair growth. One thing, I will always test your thyroid function, which we mentioned briefly earlier. I'll look at your iron levels, your vitamin D levels, and some of your B vitamin levels as well. These are all things that can be supplemented, and actually your vitamin D, every single person in the UK, regardless of how much time you spend outdoors, should be taking vitamin D from September to May at a dose of between 3,000 and 6,000 international units every day, preferably in a spray form. If you have a look at that, that's something really, really simple and inexpensive to do at home, and not only will it help your hair, but it will help your overall health. A supplement I often recommend is called Viviscal Professional, and that contains a mixture of nutrients that are known to be helpful, like biotin, together with a proprietary marine extract that is independently shown to boost hair growth. So if I'm giving advice to someone, a friend or a family member who isn't necessarily going to come for a full consultation but wants to boost their hair growth, I will almost always recommend Viviscal, and I will recommend maybe a serum or a product with some caffeine in, which can boost the circulation to the scalp and therefore help support hair growth. But in an ideal world, you'd have a more in-depth consultation, DNA testing, so we can really make sure we're recommending something that's going to work for you, and then give you a bespoke product and treatment regime to use at home. It really differs so much between each and every one of us, and for me, understanding that personal nature of your hair loss is what's really important to getting results.